Hello, welcome to Module 2 of the Elko County Health Board Toolkit. My name is Valerie Quape, and I'm a graduate intern for the University of Nevada, Reno's Master of Public Health program. And this presentation is a part of an internship I am completing with the university's School of Medicine Office of Statewide Initiatives. The purpose of this presentation is to provide a general description of the purpose and functions of local boards of health across the country, and to achieve the following learning objectives. First, we will define what a local board of health is, and then we will discuss the 6 functions of local boards of health, as described by the National Association of Local Boards of Health, or also called NALBOH. In addition, we will discuss supporting resources available to the Elko County Health Board and other local boards of health in Nevada. We will also talk about the specific nature of local board functions within Nevada in Module 3 of this toolkit. According to NALBOH, the public health governing entity can be defined as the board, commission, council, individual, or other body legally accountable for ensuring the 6 functions of public health governance in a jurisdiction. This definition may seem broad, but that is also because the structure and scope of work of local boards of health across the country are similarly broad and are often tailored to each state's individual public health system structure. As previously discussed in Module 1, there are several different structures that statewide public health systems may adopt, and even a great deal of variance between states with the same types of systems. In order to truly drill down to the purpose of a local board of health, first we must define and understand the 6 functions of public health governance referred to here. Let's review the 6 functions of public health governance in their entirety. These 6 functions include policy development, resource stewardship, legal authority, partner engagement, continuous improvement, and finally, oversight. These functions, as well as the more detailed information we are about to review, have been taken directly from the NALBOH publication, The Governance Functions. Let's take a closer look at these functions to gather a better understanding of what they mean. The first governance function that we will look at is policy development. NALBOH describes the board's role in policy development as the ability to lead and contribute to the development of policies that protect, promote, and improve public health while ensuring that the agency and its components remain consistent with the laws and rules, local, state, and federal, to which it is subject. Again, that is a rather broad statement. Let's dig a little deeper into the Board of Health's role in policy development. One way that a board can participate in policy development is through developing internal and external policies that support public health agency goals and utilize best available evidence. As described in Module 1 of the toolkit, the agency to which the statement refers is dependent on the type of system that the board is working within. For example, in a decentralized system, the board is charged with overseeing a local health department. So in that case, this would refer to the agency goals of the local health department. In a centralized system, or in a centralized area of a mixed system, such as Nevada, the board does not govern a local health department, and so this may refer to the goals of the state public health department instead. This could also mean supporting the goals and objectives of other organizations that may be a part of the local public health system, such as nonprofit organizations, social service agencies, some healthcare organizations, or others. Ultimately, this requires open two-way communication between the board and the agency or agencies with which it works in order to ensure that policies created are in line with agency and, most importantly, community needs. The board can also complete this aspect of its work through adopting appropriate public health regulations and ensuring that they are enforced. This would include food safety inspection regulations and sanitation codes, or could even be as extensive as air quality regulations or other more comprehensive health and safety codes, depending on the needs of the community. It is also important that the board develops and revises its own vision, mission, value statements, goals, and performance measures. This helps give the board and community members an idea of the long-term purpose of the board's work, while revisions can help ensure that the board is in line with changing community needs and resources. After the board has its purpose and functions defined, it is then prudent to strategically plan the course of the board's work. The planning process should include key stakeholders such as the public health agency providing services to the board's jurisdiction, as well as pertinent nonprofit and community organizations, healthcare providers, relevant departments of local government, and others as appropriate. In Elko County, this could include not only the Nevada Division of Public and Behavioral Health, but also city-level governmental officials, PACE Coalition, Elko Family Resource Center, Nevada Health Centers, Northeastern Nevada Regional Hospital, Elko County School District, behavioral services, social services agencies, and many others. Another function of the board is ensuring that the necessary policies exist. New policies are proposed and implemented where needed, and existing policies reflect evidence-based public health practices. It is important to clarify that this does not mean to develop policies strictly for the sake of having policies, but to make sure that policies are built, revised, or even repealed as needed and appropriate. It is also necessary to revise these policies on a regular basis to ensure that they are still in line with current scientific evidence and recommendations. In addition, formal evaluation of local policies can be a great way of finding out which policies are leading to the intended outcomes, if there are any unintended outcomes affecting community members from these policies, and which ones may be ineffective as they are currently being implemented. The intervals at which policies are revised or evaluated can be decided by the board and its associated public health agency, but the Public Health Accreditation Board, or FAB, recommends that policies are re-examined at least every 5 years. This brings us to the second function, resource stewardship. NALBOH describes this as the ability to assure the availability of adequate resources, legal, financial, human, technological, and material, to perform essential public health services. And those essential public health services were those that were talked about in Module 1. Let's look more into what this means for local boards. Much of the aspects of resource stewardship responsibilities for local boards are no different from or very similar to those in other aspects of governance on the part of elected officials. Resource stewardship on the part of local boards includes ensuring adequate facilities are available for the local health department for which it governs, or for staff of other programs or organizations that may be contracted to provide public health services. Legal resources may be similar to those available to other branches of local government as well. As discussed in great detail during Module 1, partnerships are an integral part of public health practice. Some health boards cultivate formalized partnerships with other governmental agencies outside of their jurisdiction to share staffing and other resources necessary to meet public health service needs. These cross-jurisdictional sharing partnerships can be a way for neighboring jurisdictions to formally pool limited resources. You can find more information about cross-jurisdictional sharing in the Module 2 Additional Resources listing. If the board oversees a public health agency or is responsible for contracting public health services with another entity, it is important that the board is directly involved in developing and approving the budget for their jurisdiction and ensures alignment of services being funded with current community needs. Not only is it important to align budgets with current needs, but also to ensure that they are in accordance with the board's long-term strategic plans. And similarly, those strategic plans include prudent financial planning practices to ensure funding for work needed to achieve the board's long-term goals. It should go without saying that all financial decisions on the part of the board should be conducted in a manner that keeps the appropriate use of public funds at the forefront of all decisions. Oftentimes, there may not be enough local general funds available to meet community health needs. In this case, the board may examine other options such as federal or state-level grants or other funding streams. This may require documentation of formal partnerships between the board and the organization or organizations that will be implementing these programs, particularly in the case of boards that do not oversee a local health department. In some cases, it may be the agency providing the service that applies for additional funding and is responsible for its management, and that the local board of health just provides letters of support or may even meet with funding agencies to help advocate for the allotment of additional funds. Next, let's talk about the board's legal authority. This is described by NALBOH as the ability to exercise legal authority as applicable by law and understand the roles, responsibilities, obligations, and functions of the governing body, health officer, and agency staff. By and large, the legal authority of boards of health in Nevada is outlined by Nevada statute. However, there are several factors that should be kept in mind as the board uses the authority granted to them. The board must ensure that it acts ethically and abides by the laws and codes to which it is subject at local, state, and federal levels. The board must also ensure that not only are mandated public health services provided to the community, but also that those services are of high quality. This should be done by working closely with the organizations that provide those services. Additionally, there may be times when the board needs to utilize the expertise or services of the appropriate legal counsel of the board, such as a district attorney. As discussed at length in Module 1, engagement of community and state partners is the foundation of public health practice. In terms of the work of local boards of health, NALBOH describes a partner engagement as the act of building and strengthening community partnerships through education and engagement to ensure collaboration of all relevant stakeholders in promoting and protecting the community's health. But what does that mean for board members that have many other duties? First, as elected officials, members of the board represent large groups of people, all with varied backgrounds and interests. As with other duties related to their post, the needs of their constituents are taken into consideration when making decisions regarding public health matters. Members of the community at large can also serve as important partners in various public health projects. Which leads us to our next point. Engaging community members from all walks of life to seek input on projects taken on by the board can be one way of ensuring that services delivered meet the needs of the whole community, as well as avoiding negative unintended consequences that could affect specific community groups. With their unique insight into the needs of their constituents, board members play a vital role in linking layers of the public health system together, whether it be by directing the course of action of a local health department or by working with another public health agency that is contracted to provide those services. They are the link between the public health service providers and the community members. As previously discussed in Module 1, the board can bring together representatives from organizations across sectors to discuss best practices and innovative solutions to public health issues facing the community. Given the dynamic nature of public health, continuous cycles of assessment, evaluation, and improvement are vital to ensure that current services address current needs in the context of the community's current situation. As community members yourselves and board members, you are well aware that the physical and financial health of communities can change over time, which is why it is important to routinely evaluate, monitor, and set measurable outcomes for improving community health status and the public health agencies or governing bodies' own ability to meet its responsibilities. Boards can engage in continuous improvement through regular community health assessments, also called community health needs assessments. Comprehensive community health assessments can give the board a picture of what the current needs of the community are, as well as having the potential to provide data regarding health trends over time, if the assessment processes are implemented consistently. If the board oversees a health department, supporting the agency's quality improvement or performance management culture can be done through asking for reports of progress of various community improvement projects or quality improvement projects, or even by helping link the health department to partners or other resources that may be needed to improve performance of the department as a whole. In addition to attending to overall system performance, holding the board itself, or if applicable, the director of the department it oversees to high but attainable performance standards can be another way that the board can engage in quality improvement efforts. Relating to the function of resource stewardship, regular evaluation of budgets and other funding allocated to public health is a part of this board function. Sometimes this may mean reducing or reallocating funding from projects that are not meeting community needs so that other projects can be funded. Others, this may mean providing additional funds to projects that are poised to have greater positive community impact if given more resources. Ultimately, the purpose here is to provide the community members the greatest benefit for the amount of tax dollars spent on public health services. And finally, board members and other stakeholders engage in continuous improvement through participating in professional development opportunities and seeking out training when needed. The last of the 6 functions of governance is oversight. This is described by NALBOH as the ability to assume ultimate responsibility for public health performance in the community by providing necessary leadership and guidance in order to support the public health agency in achieving measurable outcomes. Members of the board can first and foremost provide oversight through participating in official board functions, as well as in related activities as they are able. This provides context and personal experiences for members of the board so that they are better able to evaluate how well public health programs are being implemented in their community. This can be of particular importance when making financial decisions regarding staff salaries or contract amounts. While the board provides oversight to a local health entity and its director, it's important that there should be appropriate, positive, two-way communication that cultivates a relationship of trust and transparency between the director, if applicable, and the board. This next bullet does not directly apply to boards that do not oversee a local health department. However, ensuring that the health director position is filled and that the director's performance is evaluated at regular intervals is a part of some boards' oversight duties. And lastly, through their existing governmental connections, boards have the ability to connect different departments and government agencies to form new public health partnerships. As you can see from the material we've reviewed, the 6 functions of government being policy development, resource stewardship, legal authority, partner engagement, continuous improvement, and oversight can be implemented in various ways based upon the nature of the statewide public health system, resources available, and community priorities. A checklist tool developed and published by NALBOH has been provided along with this video so that board members can evaluate the board's current functionality and identify both areas of strength as well as those for improvement. In addition to NALBOH's 6 functions, there are other organizations and publications that identify ways for a local board of health to improve functionality. The Public Health Accreditation Board, or FAB, is the only accrediting body that may grant accreditation to local, state, and tribal health departments. Although there is not currently any accreditation program for standalone boards of health, such as the Elko County Health Board, aspects of the materials published by FAB can be used by boards to examine their own infrastructure and functions, regardless of whether or not they oversee a local health department. We're going to examine a few specific standards within the FAB Standards and Measures version 1.5 that are applicable to local boards of health and tie back to the 6 functions we have covered. First, Standard 11.1, develop and maintain an operational infrastructure to support the performance of public health functions, asks that public health agencies ensure that the appropriate organizational infrastructure is in place to ensure that the public health needs of the community are met. Although this can sound like a lofty standard, the items that FAB asks of health departments to provide here include updated and streamlined policy and procedural manuals, predetermined protocols for making difficult decisions or handling ethical issues, policies regarding the development of materials that are culturally appropriate for different community groups, and a regularly updated organizational chart. As you can see, there are limited aspects of the standard that may apply to the work you do in your community. But these are measures that are important to keep in mind when developing internal policies, such as those discussed in the policy development function of governance, or when working with the Nevada Division of Public and Behavioral Health, as they may ask for local assistance in meeting similar measures. The second standard that we will examine is a Standard 11.2, establish effective financial management systems. Here, FAB asks health departments to provide examples of ethical financial decisions, appropriate use of resources, and accountability in its financial management practices. This ties back to the second function of governance we talked about today, resource stewardship. The first standard in this domain is Standard 12.1, maintain current operational definitions and statements of the public health roles, responsibilities, and authorities. Here, we can see the direct link back to the governance function of legal authority, which is dictated by Nevada statute. In addition, as the board defines its role in community health at the local level and builds internal policies as to how it decides it will function, these documents can streamline the process of getting future board members up to date with their role in public health. Standards 12.2 provide information to the governing entity regarding public health and the official responsibilities of the health department and governing entity. And Standard 12.3 encourage the governing entity's engagement in public health department's overall obligations and responsibilities. Work hand in hand to ensure that a Board of Health is able to communicate with the appropriate public health agency through open, two-way communication regarding emergent health needs in the community, as well as progress towards addressing longstanding issues. education of new board members, discussions regarding the quality and performance of services being provided to the community by the public health agency, and having established reporting processes between the two entities. We have discussed a lot of material over the course of this module, and some of the functions and duties described here may seem daunting. It's important to remember that as a newly formed Board of Health, it's to be expected that it will take time to develop any necessary processes or policies that will help the board function in the areas we've discussed. Also, many of these functions and standards may currently be outside the reach of the board, given the resources available. However, they provide an idea of what the board may want to work towards over time. The most important thing to remember is described in this quote from the National Association of City and County Health Officials. Local boards of health are an essential link between public health service and a healthy community. What this means is that, ultimately, one of the most important jobs of a board of health is to be an advocate for the community's health. There are many more resources available to you that describe Board of Health functionality, and most of them are free. Each of the modules in this toolkit includes a listing of links to additional resources for you to peruse at your leisure. Additional resources included in the Module 2 resource listing are the Association of State and Territorial Health Officials Profile of State Public Health 2014. This is the latest publication to describe the different categories of statewide public health systems implemented across the country. This is helpful in understanding what other states may have similar systems to Nevada's, which in turn can help interested parties seek out examples of solutions to public health infrastructure questions in situations that may be similar to those experienced here. The Center for Sharing Public Health Services is a clearinghouse for information regarding cross-jurisdictional sharing services, such as those previously discussed in this presentation. In addition, contact information for staff at the Nevada Office of Statewide Initiatives who has experience with cross-jurisdictional sharing projects has been provided for more Nevada-specific information. Links to 2 documents from the National Association of City and County Health Officials, or NACHO, are provided in the Module 2 resource listing. The first of these is the latest edition of the NACHO Local Board of Health Profile, which gives the results of data they have collected regarding the structure, function, and scope of work of local boards of health across the country. The second group of documents provided here from NACHO are a part of the National Public Health Performance Standards Program, which includes a local governance or Board of Health assessment. The purpose of this assessment is for established boards to assess how they function against national standards. Since this assessment is oriented towards boards that oversee a local health department, it has not been directly addressed in this toolkit, but can be another valuable tool in examining what standards a board could aim for when working with other agencies. Much of the content delivered in this module is from NALBOH's publication, The 6 Functions of Board Governance, and its associated checklist. Links to those materials have been provided so that you may review them in depth. In addition, NALBOH provides a broad training for local board members titled Governance in Action. Although there is a fee associated with the training, it's about $50, many examples are given from across the country as to how local boards address the 6 functions of governance within the context of their own jurisdictions. As previously discussed, public health accreditation processes include standards that measure a public health agency's ability to communicate and collaborate with their governing board of health. A link to the latest version of the Public Health Accreditation Board, or FAB, standards and measures has also been included here for your reference. The Public Health National Center for Innovations, or PHNCI, was launched by FAB to help give health agencies a platform to share innovative, multi-sectoral solutions to public health problems facing communities. A link to the PHNCI website has been included so that board members may review materials for possible solutions to issues facing their community. Although there does not appear to be any publicly available local Board of Health education materials from states within the same type of public health system as Nevada, like a mixed system, there are several toolkits available from states with more decentralized systems. Even though the orientation of these tools is towards boards that oversee health departments, there are other examples given and issues discussed that may be relevant to the work of rural boards in our state. These toolkits are from Iowa, Kentucky, Washington, and Wisconsin. This concludes Module 2 of the Elko County Health Board Toolkit. If you have any questions, comments, or concerns, I can be reached at the following email address for the summer of 2017. Thank you for your time and attention.